Today we are going to discuss certain simple guidelines to identify myofunctional problems in children. Mind you, these are only guidelines to be checked at home, and for professional opinion, please visit MRC service providers clinic in your area. To simplify the problem identification, I have made a small list of 7 problems which you can check at home. 1. Most of the parents know when their child has certain finger or thumb sucking habits. Now, if these habits are given up before the age of 5, then there is no problem. But if it continues beyond the age of 5, when the actual growth is happening for a child's face, then it is really dangerous, because it is going to alter the complete muscle as well as the bone structure of the face and become something which is not very pleasant. So, such type of habits have to be curtailed after the age of 5. 2. Most of the children get cold and cough repeatedly during their childhood. It's the most common infection that they suffer. They can come back to nasal breathing once the infection has subsided. But unfortunately, most of the children land up into a habit of mouth breathing, which can cause problems for the growth and development of the face and the skeleton below. So, it is always better to check whether the child is back to nasal breathing or not, and if not, the child can be reminded. If the child is getting the repeated infections, it is always better to check with an ENT specialist or an MRC provider to see that the breathing is re-established. 3. Please check whether the child is sitting in the classroom or at home or while sleeping keeps the mouth open. As I told just now in the second problem, because of the repeated cough and cold episodes, the child gets into the habit of mouth breathing and continues as a habit. Now, this child, when he is sitting idly or even when he is sleeping, keeps the mouth open as he is breathing from the mouth. So, if this is seen, definitely you have to consult an MRC service provider. 4. Everybody can definitely make out whether the child is snoring during sleeping. Yes, snoring is never to happen, especially for children. This happens only because of the blocked nostrils and the passages, air passages at the posterior area, and it becomes like a whistle where, because of the blockage and because of the narrowing of the posterior pharyngeal area, the air when it passes through it gives a whistling sound. Now this is called as snoring in children. This should never happen. The very fact that the snoring is seen in children at night times means that the breathing of the child is already compromised. This child definitely requires consultation with an MRC service provider, and the breathing has to be re-established. 5. The irregularity in the child's dentition or the teeth in the front and sometimes even at the back also. You all know that because of the thumb sucking habits or a tongue thrusting habit, there will be front jutting out of the front teeth, upper also and the lower, while there can be certain irregularity in the lower teeth if there is some muscle aberration or certain dysfunction of the muscles while talking or while swallowing the liquids or food. So this muscle dysfunction can cause unnecessary pressures on the front teeth and cause these irregularity or crowding in the front teeth. Most of the time, the arch should grow according to the developmental age of the child, and there should be gaps between the milk teeth for the arrangement of the permanent teeth which are going to succeed. The very fact that the teeth are back and front or crowded means there is no proper growth and development happening, and this is because of the irregular pressures from the muscles. 6. All this time I was talking about the breathing. The next important thing is eating or swallowing. Now during swallowing, there should be absolutely no movement of the facial muscles, and if there is any movement, it should be only in the throat area. But those who have myofunctional problems or muscle dysfunction, they will be actually doing a lot of movements of the upper lip, lower lip and the sides of the mouth, as well as sometimes the tongue also will be shown between the teeth. All these are telltale signs that this child is not swallowing properly. There is some problem. I'll be showing a small video to show you exactly how a normal swallowing is and how a wrong or an infantile or a reverse swallow is. Last but not the least, 7. With all these problems, the child does not sleep properly at night times, because when the child is breathing from the mouth, he tends to get up repeatedly during the deep sleep period. In such cases, the child is always irritated in the morning and not very active, and in the bargain, they are lethargic, they are not attentive in the school. Most of the children have morning school, so they are not attentive and they will be lacking in their school progress also. If any of this is seen, definitely it is a telltale sign that your child is not getting proper sleep during night, and because of which he is inactive or lethargic during the daytime. Children should get up fresh and active and should be active till the time they sleep at night. Once they sleep, they should be in deep sleep. The very fact that they are going on getting up in the middle of the night either to use the washroom or to drink water means their sleep is quite disturbed, and such children definitely need certain myofunctional treatment. These were a few guidelines to check whether the child requires myofunctional treatment, and in such situations, Myobraces will definitely help. Thank you for watching this video. Please do like, share, subscribe and comment below. Bye.